I'm Lisa Tyler. I'm the host of Senior Connections, and this is our monthly look at all kinds of issues in the Muskegon County area dealing with older adults and the people who care for them. Each month we have a different topic. It might range from prescription coverage to Medicare to services available in the community, and we hope that we're helping you navigate what can be a confusing web of services for all older adults in the area. So we want to help you try to figure out how to go to get the information, who to talk to. And today I'm very excited that I've got two special guests with us from the Alzheimer's Association. We're going to talk about a couple of really big, important events that they have coming up. So I think about every year in August we try to have somebody on to talk about the Alzheimer's Research Night on August 22nd and the Walk to End Alzheimer's, which comes in September. So today with me are Tim Breed and Aaron Murphy from the Alzheimer's Association. And welcome. I'm very happy to have you here. I know that, Tim, you've been on before. Yes. Aaron, I'm not sure whether I've had you.
This is my first time.
So first time for you, second time for you. So, but it's been a year, Tim, I think exactly, pretty much exactly since we started. So let's just talk a little bit about your background, what you've done before you came to the Alzheimer's Association, and what you do there now.
Sure. Well, thank you. Lisa, we just love being here and the opportunity to talk about the events that are coming up on behalf of the Alzheimer's Association. For me personally, I've been a part of Muskegon life for a good many years. We go back. Mm-hmm. We have a bit of a history there, and that's a good
about
history.
1990.
Yes. Ooh, dating.
When we were babies.
That's right. Teenagers, fresh out of school. And in my roles, various roles in Muskegon, I've worked primarily within the nonprofit sector, a lot in the hospital settings, communication, public relations, community outreach. And that was a very nice way to kind of lead into my current role with the Alzheimer's Association. I'm a community engagement manager. I wear a couple of different hats under that title. The first one being to make sure that we're providing some educational programs in the community. And we present a variety of different topics, all related to Alzheimer's disease, but they range all the way from helping people understand early signs and symptoms, to then maybe for those folks who are starting to move through the disease process, what communication looks like at different stages. We also have programs that touch on some of the more familiar behaviors that might manifest as somebody's getting a little later in the disease of wandering or repetitiveness or aggressiveness. So community education is a part of what I do. I also wear the hat of volunteer recruiter and trainer and orienter and placement. And so we're always looking for volunteers to join up with the association. And we have a variety of roles. The community education part is one, where we would prepare a volunteer to go out and actually do the types of programming that I'm doing. We also look for individuals to serve as our community representatives, and they might just be at an information table, at a health fair, just being in the public space to kind of remind people and bring material that we have. We look for faith-based volunteers. It might be a member of a house of worship who is just interested in kind of being our eyes and ears in that particular space. We don't ask them to do presentations necessarily, but we want them to be a source of referral. So if they're sitting next to somebody in the pew and they realize that maybe a family is struggling with somebody with dementia, that they would refer them to the information that we have in our office.
So you've got a really great variety of roles. Because you think about the education, the first one you said, it takes a special kind of, you and I have done public speaking and things for a year or two. We've done that for a while. And I have so many people who say, I could never do what you do. And growing up, I never thought I could do that either. But that does take a special kind of person who is willing to get up in front of people that they don't know and talk. And then a little less so to work at a fair and hand out information. I can probably do that if I feel I've been educated. But the church, the faith-based role is one I hadn't heard of.
Yes.
That's something almost anybody could do. Anybody who just has a passion and is willing to learn a little bit and just be a connector is really what they're doing.
That's exactly what we would like them to do. Just to kind of be aware of those that are around. If there's anybody struggling, do they see somebody within their house of worship that are showing perhaps some of those early signs and symptoms, and if you're sitting next to someone, on a regular basis, you might feel a little more comfortable saying, I know where you could get some information, or I know who might be able to provide you with a few answers about what happens, what's going on.
But they can be helpful with the pastoral care as well that happens, because a lot of times people might not take it as well from one of us sitting there, but from their pastor or their worship leader, they may, so they can be an informational source. So, boy, my head's already booming with ideas of people, of ways to help you make some of those connections. But we'll talk about that more later. So, Erin, let's hear the same from you, your background and how long you've been with Alzheimer's Association and how you came to be there.
Yeah, absolutely. So I'm coming up on a year with the association. I started last August. This is my first job right out of college. I graduated from Hope College in 2018.
That's where my daughter's going.
Oh, I love it.
Just a few days.
It's wonderful. It's wonderful. So I graduated from there and then made the move and started working here last August. My role is a special events coordinator, so I manage 2 walks. I manage the Muskegon Walk as well as the Mason County Ludington Walk. And I also help with a fundraising initiative called The Longest Day, which is more of a do-it-yourself fundraiser, turning anything that you loved or something that your loved one who passed away from Alzheimer's disease, something that they loved, turning it into a fundraiser, and just kind of going from there. And it all circles around the longest day of the year, which is the summer solstice in June. So we're kind of winding down on that and ramping up for the walk season coming up here in September. So anything having to do with money and fundraising and helping to find a cure and treatment, absolutely. So
what got you interested in the Alzheimer's Association out of college? What was your degree and then your interest?
Yeah, absolutely. So I studied communication and business in college and just kind of got involved in a couple different nonprofit organizations that I had internships at, that I worked for kind of recreationally with, extracurricularly, I guess. And so I got involved in that, and then I had a personal connection to Alzheimer's disease as well too. My father on my dad's side of the family passed away when I was in middle school from the disease, so obviously it was something that I had a personal connection to. I had seen a little bit of the effects that had had, and then obviously the effects it had on the rest of my family being caregivers as well. So it definitely created a passion in me that I wanted to do my part to help find the first survivor of it. So, yeah.
Well, we'll get there eventually.
Absolutely.
Right? All right, so let's talk a little bit about Alzheimer's disease and what it is. So statistics I've read, more than 5 million Americans live with Alzheimer's, and we know that that's increasing, right? Because I remember, and this may be an old statistic, I remember from a year ago, though, somebody in the United States develops Alzheimer's just about every minute, like 66 seconds. Right. So has the number changed? What are we seeing?
Well, we're seeing what the experts had predicted, which is those numbers are on the rise. Currently, the estimate is about 5.8 million individuals in the United States that are diagnosed with Alzheimer's. In the state of Michigan, the number has climbed to roughly 190,000 individuals that are affected. And that number is expected over the next 6 years to climb to about 220,000. And you may wonder why is this number climbing and climbing so rapidly? And there are 2 things at play. One is kind of good and one is not so good. First of all, there is an older generation that is living longer. That's good, because the alternative isn't so good. Right. So it's good that we're living longer. But then there is this large group of us, myself included, that are the baby boomers, and it is a huge population, and we're all living to an older age. Well, age happens to be the largest risk factor for developing the disease. So if you've got this large population that is living longer, which again is the good thing, you're going to find more and more individuals developing Alzheimer's disease or some other condition that's going to manifest some dementia of some type. And so state of Michigan, again, in the next 6 years, expected to get up to close to 250,000 people, which is kind of a staggering number. And those are just the individuals that are affected by the disease. You then have the caregivers, and you've got the professional community. We really don't have the facilities. We don't have the staff.
We don't have the caregivers.
We don't have the
paid
caregivers.
Or unpaid.
Paid or unpaid, and it is. And I want to go back to something that Erin said about the longest day. That was very intentional for the association to pick the summer solstice as the longest day, because if you are caring for someone with the disease, or you yourself have something causing dementia, every day can feel like the longest day, and it begins to wear individuals down, those with the disease and the caregivers. And so it's so important to be able to kind of use those points in time to kind of raise the awareness level of how prevalent the disease is. It isn't going away anytime soon. There are hundreds of millions of dollars that are being donated in terms of unpaid care. The family members, the friends, the church community, the community as a whole. And then there is the entire paid portion of the community that's stepping up in terms of long-term care facilities and memory units. But it is a disease that is impacting a lot of people. It's going to impact a lot more. The unfortunate news is there is not anything right now available that is either an effective treatment to prevent it, or to slow down its progression, or to cure an individual. We'll talk about the research night coming up, but it's so important then that the effort be made to fund the research that's going out there to try to get ahead of this disease.
So so age is the top risk factor,
Correct.
as you said. Are there other risk factors
Yes.
that have been identified? What are some of those major ones?
You know, genetics, family history, if you have a sibling or a parent who has had Alzheimer's disease, your risk is increased slightly. Now, I want to caveat all this by saying just because you might be at higher risk does not mean you're going
Right.
to develop the disease.
And growing older does not mean you will develop
Correct.
the disease.
Correct. Absolutely. So there are just some populations that have a higher risk factor. And those that have had a parent or a sibling with the disease, the risk factor is a little bit higher. Age, we mentioned, is higher. There is a genetic component that if you have a certain type of gene, it puts you at a higher risk. And if you were to go through genetic counseling, that might be the kind of thing, if you wanted to know ahead of time, you could find out. There are populations, ethnic populations that are affected. African Americans, twice as likely than their white counterparts to develop the disease. Hispanic Americans, about 1.5 times more likely. And yeah, it begs the question,
No.
why
They haven't
those
figured out
No.
why yet, though, have they?
No.
That's the thing. It's so negatively impacting so many people, but it's just so broad. I mean, because Alzheimer's is the largest
Correct.
kind of dementia, but
Correct.
60 to 80% of that. But still,
Right.
the brain is such a. I have a son studying neuroscience, so the brain is so complex. That I know they've made huge strides in understanding things, but still there's so much more to learn.
We seem to know more about the effects of the disease and how it affects the individual than we know about its origin. Then we certainly don't, we haven't unlocked the keys as to how to keep it from progressing. And with each individual, as we all are individuals, the disease progresses differently. And I think we all know individuals who may have been diagnosed, and then 2 years, 3 years, 5 years later, you only see some of the early, maybe minor signs of it showing up. Other individuals are diagnosed, and within a year, you see significant changes in their
And you just
life.
can't predict how that's going to happen.
Correct. Yeah.
So you said there's not really any treatments that are found to be effective at all. So
There are medications on the market, and they basically help to boost memory. Memory is created using the chemicals in the brain, and there are medications that kind of can boost, no different than taking maybe an antibiotic to boost your immune system. There are medications on the market that will help to kind of boost the brain's ability to function. Doesn't touch the disease, doesn't stop the progression. It's only making use of the chemicals that are still there and the parts of the brain that are not affected to kind of help with alertness and memory and a few of those things. And that's not to discourage people from exploring those, because I would say anything that helps to improve quality of life, helps boost memory.
Right.
Talk with a doctor.
So there are some things out there that may help with that.
Correct.
But people just need to be aware they're not cures. They're not going to stave it up. They're not
Exactly.
even necessarily going to prolong.
Exactly.
It's just going to maximize what you've got.
It's a perfect way to put it.
When, and we haven't really ever talked on the show about Dementia Friends, which you and I have been through. Well, I facilitate, but when I think about the picture of the brain and how much is lost through all kinds of dementia, but there's still a lot there. So what those are doing is taking what's left there and boosting that a little bit. So,
Correct.
So we'll come back and talk some more about that if we've got some time. But we are in August.
Yeah.
And so I want to talk about, Erin, especially it's your first time on, let's talk about these events we have coming
Absolutely.
up. So, and I don't know how much you're involved with the research night, but that comes up on August 22nd. And we've done this for at least the last few years at Tanglewood Park, where Senior Resources is located. And let's talk about that.
Absolutely, yeah, and I will say Tim has done an excellent job in planning this event this year. So yeah, it's going to be on August 22nd at Tanglewood Park. We're going to have Dr. Bruno Giordani, of the Michigan Alzheimer's Disease Center. He's going to be giving a presentation explaining some of the logistics and a little bit of what is Alzheimer's disease, what does it actually look like on a medical standpoint in the brain, and then talking about some of those prevention and treatment methods that are being researched right now, some of the studies that are out there, and some of the science behind all of that.
And so this is open to the public?
Correct.
And there's
Yep.
no cost?
Yep, absolutely.
And it's at 6 p.m., right?
We will
Second,
actually
or-
begin inviting people to come in at 5:30
Okay.
for registration, and for those that are pre-registered who have called our toll-free number or some other method of pre-registering, there will be a nice boxed meal. And I do want to take a quick minute here to give a shout out to Senior Resources for being one of our sponsors of the event, also Age Well Services and Life Circles PACE. We could not make this happen without those
Well, we're all
organizations.
pretty
and
darn
so-
passionate about this, and it's a great collaborative. And of course, we're the three in the Tanglewood Park building,
Yep.
right across the street from where you are now.
Yeah.
But it's really great because Life Circles has hosted it for at least this. Let's see, this is at least the third year,
Yep.
if not the fourth year of it. Age Well provides the meal. Senior
Yes.
Resources provides the funding. So if you come, you
Yes.
get a wonderful little box meal, and I've done it for a few years. What I love about it is I always just call him Dr. Bruno because
Yeah.
I can't the last name.
Yeah.
You're done.
So he doesn't talk in medical speak. He talks in real language. And I think people come year after year because he's also has always just come back from the National Alzheimer's Association conference, right,
Yep.
about research. So he's coming and literally bringing us real cutting edge, like less than a month old news
Correct.
usually.
Fresh
And so how do people, can they still sign up?
Absolutely, yes. I would suggest probably the easiest way is to call our toll-free number.
You want to give us that?
Yes, I will, as soon as I put my glasses on. It's the 800-272-3900.
Okay.
So that, or they can also go to, alz.org. That's the main website. It takes a little navigating from there, so I think toll-free number is a little easier way to cut through. But, all we ask for is their basic contact information. They will be put on the registration sheet, and as long as we have at least a few days lead time or more, if we can get it, we will make sure that there's a small box meal waiting for them.
Great. And what do you hope that they take away from that event?
Well, there are a couple of things that I think are a real benefit to doing the research night. One is to hear, as you had said, kind of the latest news that comes not only from the international research that's going on, but Bruno himself is from a research facility in Ann Arbor, so there is research going on in our own backyard, so to speak. So getting an idea of what is being worked on in different locations throughout the country, that's good to know. I think part of what he will be sharing, and I won't spoil his presentation, but there is a lot of work being done, as there has been for a long time, on prevention and cure, but there's also equal emphasis on detection, because it's just as important to know how to detect it and how early we can detect it. The earlier it can be detected, the longer the window of time to do some interventions.
Right.
So he will, I'm sure, touch on that. So understanding what's happening on that research field, he offers a wonderful Q&A, question and answer at the end, and he is open to any and every question. And I don't think I've seen one that stumped him yet, maybe this year. But he, as you said earlier, he's so down to earth that you can ask anything in layman's language, and he is glad to entertain that question. And the final thing is, just looking around the room, I think it gives a sense of reassurance that I'm not the only one with questions. I'm not the only one who's concerned about a loved one. There's a room full of people that are probably there because they're taking care of someone, or they themselves are worried about themselves.
And I know I've been there with people who either have had a family member and they're worried about the genetic part of it, so a lot of times that's what those questions come from. Grandma had this, does that mean I'm likely to? And that's an understandable fear, and you're right, he's very great about answering those questions and trying to alleviate those fears a little bit. Of course, because none of us know what that's going to be. But I would really encourage you to try to call the 800 number. We'll give it again at the end of the show. But it's a really great event. We've had usually 100 people or more who come to that. The room's full. And you can also get some good information on some other agencies at that. So then let's talk, Erin, about the next big event, the one that you spend a lot of time on, the Walk to End Alzheimer's. I'm going to give a quick little plug. Senior Resources has had a team in this for many years.
Oh, yeah.
We are very competitive. We expect to be. We will not. We know the one or two teams that are always really up there with the fundraising, but we are usually in the top 5 in the area. We have a very big competition with our friends at Life Circles Pace. I think we're even having penny wars this year or something. But talk about that. It's coming up when and where and how long has it been here? Give us all the good information about that.
Yeah, absolutely. So the walk itself this year is going to be on Saturday, September 21st at Heritage Landing. This is I think we're going into the 18th year now that we've done the walk. It started in 2001. So it's been a kind of a staple of the Muskegon community and something that we've been able to see grow over the last several years, which has been really exciting. Last year we raised about $67,000 as a Muskegon community. Yeah, so just similar to how you were saying, being competitive, we're always in competition with ourselves, especially in something like fundraising. And so we're setting a goal of raising $75,000 as a community this year, and we're well on our way. We're about 40% of the way there already, and we're still about a month out. And so a lot of the funds come in in that time frame too. So
I know we don't report ours because we don't want to tip our hand.
Absolutely.
So last minute we come in with, okay.
Absolutely.
How many walkers are there usually?
So last year we had about 400 to 450. So we're looking to have about the same, maybe hopefully a little bit more.
And so one of the things that I love about this, even though I've been trying to work on better health for a couple of years, but you're not doing a 5K run. This isn't a run. This is a walk, and it's downtown, and we leave Heritage Landing, and we walk down Western, right? Right, Western.
Yeah.
And we kind of walk down to about the farmer's market, as I recall, and loop around there. So you get to look at the shops. You could stop if you wanted. It's very casual and just nice and friendly.
Absolutely,
right?
and that's something that's been a huge priority of ours. Is we want everyone to feel welcome. People who have Alzheimer's disease, people who are caregivers, kids, adults. Dogs are allowed at the event too.
I've seen strollers and dogs and wheelchairs.
Yes, absolutely. And really, what we like to think of the walks of our. Oh my goodness, I'm getting tangled over my words. We love to think of them as a big support group. So we have a lot of people there that are present that just get to share their stories, get to meet other people who are going through similar things, kind of like what you were sharing about earlier, Tim. And it's really a beautiful way to build connections and just to kind of have everyone come together, whether you have a direct connection in your family or not, and to say we are fighting to see a world without Alzheimer's, and we are fighting to see that first survivor who, as the Alzheimer's Association, we believe has already been born and is out there. And so it's just a matter of finding them and continuing to fund that research and those treatments too.
Hopefully we find them soon.
Absolutely.
Yeah. But we all get, as I recall, we get kind of a windmill kind of flower, and they all represent different, I can't remember what all the different colors are, but I know I have a yellow one by my flagpole with my friend Arlene's name on it that I one year didn't plant it in the little garden that you do. But
do you want to touch on those?
What's the significance of the colors?
Absolutely.
People will see that when they're there. They'll see quite a few.
Yeah, so part of that is we do have, it's called the Promise Garden, and so we have a Promise Garden ceremony leading into the walk. So everyone who comes gets a specific colored flower based on your relationship to the disease. So purple is having lost someone to the disease, blue is having the disease, orange is being a caregiver, no, yellow is a caregiver, I believe. Does that fit your description?
Yellow is
yellow is
somebody.
Oh yeah. And then orange is not having a connection but wanting to see an end to the disease. And so everyone has this, and we have this really beautiful time where everyone who has that specific relationship gets to lift up their flower, and eventually we see the full spectrum of the garden. And then we have now a white flower representing that first survivor. And we don't have any white flowers in the garden yet, but we're hoping to see that one day more and more white flowers pop up at this event.
It's always really fun. It's lively. You've got music. We've done like some little stretching, really fun, lively stretches or Zumba kind of things to get us going. Even though it's a casual walk, we still want to make sure that we're all stretched out for all of that. Anything else we need to know about that? Do people need to register for that ahead of time?
Yes. So, well, not ahead of time. So you can either register online at act.alz.org/Muskegon. You can register online that way. We also allow people to register the day of and just come out that morning, sign up then. It's completely free to register and participate in the event. It is a fundraising event, so a lot of people will share on social media, ask their friends and family for donations, that sort of thing. But it's, again, free to everybody to come on out.
They don't have to fundraise.
Correct.
We encourage fundraising. And if you raise $100, you get a T-shirt.
You do get a fun special purple T-shirt similar to the one I'm wearing, yes.
What a coincidence.
I know. Almost like I planned it. But yeah, and then we also at the event will have some snacks, some food. We'll have a balloon artist this year that'll be making the Promise Garden flowers actually out of balloons if people want to take those. We've got some fun little things in store. So
there's usually some photo opportunities and fun things because we always make sure we get
Don't forget to mention Andy.
Oh yes, and Andy O'Reilly is going to be serving as our honorary chair this year from Positively Muskegon and Muskegon Channel Radio.
Oh, that's a perfect. I know that he's already done some stories on that, and he's a perfect ambassador for all kinds of things. So, well, they just told me we only have about 5 minutes left, so we're going to switch from those two important events, but try to remember August 22nd and September 21st. One's a Thursday night, one's a Saturday. Let's talk a little bit, Tim, real briefly about senior millage and funding, because that helps fund your position and what kind of things you're doing with that.
We've been so fortunate that we are in our second year of funding through the Muskegon County Senior Millage, which I'm a senior, well, I say I'm a senior, but also a county resident, so it's something that I pay into as well. And it's always nice to be able to see those dollars invested come back into the community. A lot of my work in community education has been underwritten by those dollars from the senior millage. We've been able to reach different parts of Muskegon County. We've got some areas that we've not been able to get into yet, but we continue to look for those opportunities. But we have been in a variety of different churches, libraries that we've been in, some businesses that have stepped up to say, can you come in and do a lunch and learn for us? And so, again, it's all about, and these are all free. These are all free. Our programs run roughly 45 to 50 minutes on a variety of topics, and we just try to leave the audience with, again, a little bit more knowledge about the disease, and then also that sense that there's a lot of us in the same boat, and that nobody is alone, and nobody should feel that they are on their own and alone in taking care of someone or taking care of themselves.
Great. So I'm going to give a real quick little plug since you talked about the senior millage and all of that, because I don't know that we'll have our show on before that. On Friday, September 13th, there is planned to be a senior millage open house that will allow from 10 a.m. till noon for people to come to Forest Park Covenant Church on Henry Street in Norton Shores and learn about the many services, including the Alzheimer's Association and everything else that is funded by the senior millage. A great opportunity to get information on that. And you can find that information on our website. Alzheimer's Association has so many great things, these events, Tim and his speaking and things, and then you've got a lot of those education sessions, you've got support groups, all kinds of opportunities for people to learn. So I'm going to give a couple of, in the last minute or two, a couple of ways that you can get information on that. One of the best ways to make sure that the phone is answered, because these two are out doing things all the time, so they may or may not be in the office. And there's not many more people besides you two in that office.
Now, the two
Pretty
of us.
much.
Yep.
It is. This is your Muskegon chat.
So if you're calling right now, we're not
there.
But you can call 800-272-3900, 800-272-3900. That takes you to the toll-free number, so it doesn't cost you anything, and then you let them know Muskegon, and they will help connect you and get you the information you need. So you can get information on caregiver support. You can say, I want to find out more about, I want Tim to come and talk to my church or my workplace, and all kinds of things that we can do. And almost everything they do is free. Really, there's not cost for anything that I can think of.
No,
nothing at all. So try to remember that again. They also have a great website, www.alz.org. Again, 1-800-272-3900. And if you can't remember any of that, always 24 hours a day, 7 days a week, you can call 211 and tell them what you're looking for, and they will get that information. So in our last few seconds, Tim, Aaron, thank you so much. This half hour just blew by.
Right.
So much great information. We will look forward to, I know I am doing the walk. I will see you also at the research night for some of that. So we hope that we'll see you at some of those events. Thanks so much for joining us, and we'll talk to you next month. Have a great day.